Hey guys, I'm making this video to answer your questions about SOT. I often get a lot of the same questions and it just takes me a really long time to get back to everyone, so I wanted to make this video to hopefully help disseminate that information that I have to you a little bit more effectively and thoroughly. So without further ado, here are your most asked questions about SOT. All right, so the first thing that you guys ask me all the time is just a general, what was my experience like with SOT? And overall, it was really awesome. I really don't have anything bad to say about it. I did have some symptoms flare up a little bit in the couple of days after I did get the treatment. But at the same time, I also was under a lot of stress just personally, and I don't do very well with traveling. Traveling's always just been really hard for me. So the combination of me working way too much and not allowing myself a chance to kind of recuperate from the travel, I think a lot of that, it's probably 50% of at least of why I felt bad in those couple of days after SOT. I think if I had just chilled out and given myself like a few days off, called out of work, and just rested for a little while to recover from the trip and just allow my body a chance to kind of acclimate to what was going on, I don't think I would have had probably any of the symptoms that I ended up having. I just had a little bit of minor flaring. I had the occasional hive, just a lot of fatigue. Again, I think that was a lot to do with traveling, but actually I won't tell you exactly how I felt. I'll let my past self tell you how I felt. If you were following me on Instagram right after I got this treatment done, you probably saw these Instagram stories, but I'll just repost them so you can see kind of the mindset that I was in and how I was feeling right after SOT. I just wanted to share that I do feel really good, like health-wise. Obviously, I'm really flippin' tired, but a lot of my chronic nerve pain is gone. Before I left for my trip, I was having really persistent, low-grade joint pain and just some chronic nerve pain in my legs, which was really frustrating. And then I just kind of noticed about 2 days after I got the procedure done, I was like, oh, cool. My feet don't hurt anymore and my joints aren't aching. So I'm not one to count my chickens, as they say, and I'm trying to be as unbiased as possible because I don't want to introduce a placebo effect. But for sure, my nerve pain is almost gone. And what I'm realizing is how much nerve pain I actually had just chronically, because I think just got used to it. So it's really cool. And the fact that I've been working so much and that I haven't just keeled over and died is also pretty cool. So, I am kind of grouchy though, which is why I'm putting this dog filter on because it makes me smile. So yeah. I noticed right away my joint pain subsided, my nerve pain got a lot better, and my energy levels were a lot better than I was expecting, despite the fact that I was working so much. So those were the things that I noticed right away that were really awesome. Week 2 is when I started to notice the cognitive improvements. So my depression kind of started to subside. I started to have more energy, more motivation. I just started to feel more like myself, my pre-Lyme self. So that was really exciting and very encouraging. I'm a month away from being 2 years post-SOT, and I just really have found that I've continued to get better. And I think now I don't consider myself in remission anymore. I consider myself cured. I have not had a single symptom of Lyme disease since, those initial couple of weeks after my SOT. So, and I certainly am not as careful as I used to be. I eat a lot of things that I never would have been able to eat before. I'm not as sensitive to smells or pollen or things in my environment. I'm much more tolerant of just stress, and things in general don't upset me as much. I don't get as flustered. I'm not as sensitive in general. So those are all things that I've definitely noticed have improved a lot. And like I said, I just really feel like myself, which is really, really cool. So for people who are curious as to what the timeline for SOT looks like and just what the procedure itself looks like from start to finish, it's super simple. You have to have had a positive Lyme test within 6 months. It doesn't matter what lab. So if you are negative on ELISA or a Western blot, but you have a positive IGeneX test, that's totally fine. They just need to have any sort of positive test to show that you have Lyme. Then you'll do your initial blood draw, and if you don't live in the same state that your healthcare practitioner is in, like I was, you can go to any LabCorp or any other lab in your area, and they can do the blood draw for you, so you're not having to travel twice for the treatment. You only have to travel to get the actual infusion. So for me, I lived in California. I was seeing a doctor in Georgia, so I was able to do my initial blood draw in California. It was totally easy, not a big deal at all. After you get that initial blood draw, it takes about a month for your blood to go to Greece, and then for RGCC labs to make your SOT molecules specifically for you, and then to ship it back to your healthcare provider who is going to administer the SOT. That process takes about a month. Once your SOT gets to the office, the procedure is the simplest and easiest Lyme procedure I've ever had. The nurse will just do a IV bag of saline, and then she'll push the SOT solution pushed into the IV. Super simple, completely painless, totally not a big deal. And even, during the appointment and afterwards, immediately, I didn't have any sort of reactions or bad feelings at all whatsoever. Yay! And after you get the SOT treatment, those molecules are gonna live in your body for about 6 months. So they're gonna keep, doing their work for about 6 months. It shouldn't take that long for them to be effective, but they are there for 6 months. The next thing I get asked is, did I only do one SOT, or do I only need one SOT? Did you get multiple SOTs? Did you have co-infections? So the answer to that question is, I have only had one SOT. I only think I needed one SOT. Some people have a completely different experience. So again, this is going to be something that is very personal to you as the patient and what is going on with your body. I did initially, when I had Lyme in 2009, I did have co-infections. I had Ehrlichia and Bartonella as well. I also have dealt with Mycoplasma co-infections. I think my old co-infections never came up again when I retested before SOT. So I think those were taken care of with the antibiotic treatment that I did when I was first sick with Lyme. So that was not really a question that I had to address. I did have post-SOT a flare-up of Mycoplasma, which I treated with antibiotics for about a month, doing a 1 day on, 1 day off antibiotics, and that cleared that up right away. According to Dr. Sloan, and you've known this if you listen to our podcast, Lyme works differently in the body than a lot of these other infections. So if you're able to sequester Lyme, your immune system might be able to take care of those other co-infections by itself. So I wouldn't necessarily just right off the bat think that you need to do more than one SOT. I definitely would do SOT for Lyme, and then just kind of see where you're at, see if you're able to maybe do some herbal or antibiotic therapy to get rid of, if you have Babesia, Bartonella, see if your immune system's able to bounce back and take care of it itself. It might be that you need another SOT. It's very specific to the individual. So that's something I would definitely just make sure you have a dialogue with your doctor about. The next question I get asked is, was I on antibiotics before SOT? And my answer is kind of. When I first got sick in 2009, I was under the care of Joseph Jemsek, and I did do a lot of antibiotics for about 2 years at that time, because that was really all that there was. There really wasn't any other options, and that did help me to an extent. But by like 2011, my body could not handle being on antibiotics anymore, so I went off of them. And since then, I've had a couple of flare-ups and times of being in remission, and I have tried alternative therapies throughout those periods of flare. So I did not ever go back on antibiotics just because I really did not have a good experience being on them initially. That being said, I do know a lot of people who have gone on antibiotics, who have done antibiotics with SOT. You don't have to do antibiotics with SOT, and if you're not on them, you probably shouldn't go on them. Obviously, again, this is totally dependent on the individual, and you should listen to your doctor. But if you are on antibiotics, or if you're currently, you have been taking them or you're currently taking them, don't worry about it. It won't affect the SOT at all. How much does it cost? How much does it cost? Everyone wants to know how much it costs. How much does SOT cost? For me, all said and done, it was about $4,000, including doctor visits and all the blood draws. I know I've seen for some people that they've been able to do it for a little bit less than that. Some places a little bit more than that, but that's kind of the ballpark of what I've seen the cost for it be, including, you know, doctor's visits and all of that stuff. You know, I have spent so much money on treatments for Lyme disease. Between my parents and I, tens of thousands of dollars we've spent. I know people who have spent hundreds of thousands of dollars on treatments for Lyme disease. So I mean, the value of what I have gotten for this treatment is amazing. And I would, if I could go back, I so wish I could go back and do it again, because I wish I could just get SOT. The other thing I get asked all the time is if there's something that people need to do or take before, during, or after SOT in order for it to work better. And I will tell you guys, I did absolutely nothing. I just got the SOT and went about my life. There are tons of things that you can do, like nutritional IVs or herbal therapies or even stem cells, to help speed up your healing process, that I think are really great. But if you are not in a financial position to do those things, all of that is just going to be a bonus. And there's nothing else you need to do in order for the SOT to really work its best. That being said, I do think it is really important to make sure you are getting your SOT done with a healthcare practitioner that is familiar with Lyme, that is Lyme literate, and that understands what might need to follow in the aftercare post-SOT. Frequently with people who have Lyme disease, it's not just the Borrelia burgdorferi that's causing them a problem. Very often they have co-infections or other complications like mold exposure, candida, mast cell issues, histamine issues. There are so many other things that often kind of come in a package with Lyme. So even though the SOT is extremely effective against getting rid of that Lyme bacteria, you still need to make sure you have a practitioner that understands what might need to happen after you get your SOT. So if you need to address candida, if you need to address, you know, parasites, Bartonella, other, you know, co-infections like that, that you have somebody that is familiar with those things and can help you out with that. So I think the last question that I get asked the most often, and probably the one that's the most important, is, do I think SOT worked? So before I got SOT, even when I was in remission, I still was dealing with histamine intolerances, joint pain, nerve pain, fatigue, depression, brain fog, lack of focus, lack of motivation, all of those kinds of things. A lot of it to the extent that I really didn't even notice, just because I had been dealing with it for so long. So in the last 2 years after SOT, all of those things have completely gone away, except really for a little bit of depression still, but I think that's genetic for me. It runs on both sides of my family, so I think I'm a little bit out of luck with that one. But definitely it has been so much better, and completely not to the extent it used to be when I was dealing with Lyme. So I'm very, very confident in saying that it cured me, it worked. And now actually my mom has had an SOT for Lyme, and she has had a fantastic experience with it. And my dad is actually, he just got a tick bite recently and is now going through the process himself. My second worst fear is getting Lyme disease again. My first worst fear is for someone that I love to get Lyme disease. When my dad called me and told me that he thought he had Lyme disease, and I was not immediately just devastated, I actually was just happy and excited that I knew how to fix the problem, I think really says a lot. I hope I was able to answer some of the questions that you have. If you have questions still that I didn't answer, please leave them in a comment below on this video, and I'll make a follow-up video to answer any more questions. Subscribe to my channel if you want to see more videos like this, and give this video a thumbs up because it helps other people find this information. So thank you guys so much for watching. Have a great day. Bye.